So we have this question in which a 27-year-old woman with the past history of rheumatic fever denies dyspnea, orthopnea, fatigue, and performs daily activity without limitation. That means she has no symptoms. Mitral valve area, if we see, mitral valve area is 1.3 centimeter square. Mean transmitral gradient is 8 mm Hg. Mitral valve morphology, that is pliable leaflet, minimal calcification. MR, mitral regurgitation is 1 plus. Left atrium is dilated. Pulmonary artery systolic pressure is 55 mm Hg. Rhythm is sinus and no left atrial thrombus. Now they are asking what is the most appropriate management. So before understanding the management, come to this thing that what is PMDC. PMDC means percutaneous mitral valve balloon commissurotomy. It is also known as BMV, that is balloon mitral valvuloplasty. What we do in this, right, the balloon catheter is passed from the femoral vein through the inferior vena cava into the right atrium, and then into the right atrium a transseptal puncture is done, and through the right atrium it moves to the left atrium, and then this balloon is pushed into the stenotic valve, and then it is inflated, and when it is inflated, the mitral valve opens up, so stenosis is relieved. But most important thing that happens in this is that since it causes dilatation of the mitral valve, so some amount of MR, that is regurgitation, always develop with this. So but please remember, before doing PMDC, although it is a very good intervention, non-surgical intervention, you have to look for the contraindication. There should be no left atrial clot, because left atrial clot can come to the left ventricle and then they can go to the systemic circulation and can cause stroke. Secondly, there should be no MR of grade greater than 2, that is plus 3 or plus 4 MR. You cannot do PMDC because that can cause acute valvular insufficiency and patient can die because of the shock. And the third is calcified or rigid mitral valve, that is a low Wilkin score. If there is a low Wilkin score, please remember, if you have a low Wilkin score, that is score less than 9, then you can go for the PMDC. But if the score is more than 9, that is 10, 11, you cannot go for it. And a calcified valve is a absolute contraindication for the PMDC. So this is PMDC. Now coming to the patient. Now patient can be divided into A, B, C, D in 3 stages. Stage 1 is a patient as risk who has a history of rheumatic fever, but the patient has no symptom, echo is normal. So this patient requires no treatment and this patient will never come to you. Second is a stage B, that is a progressive disease. Now here the patient echo will be resting, echo will be normal. Echo mitral valve area will be normal, the resting echo will be normal. The only problem will